Hello, my name is Derek Schultz. I'm a respiratory therapist with Advent Home Medical. I'm about to show you the setup and use of the Airvo 2 device made by Fisher and Paykel. The Airvo 2 is a small, rather quiet humidification device that can deliver high flows of gas to the patient. There is also an oxygen adapter that can be placed for patients who are also receiving oxygen. On the top of the machine, you have a power, a silence, an up and down button, and what's called a play button. It's a triangle pointing to the side, like playing on a tape player or a CD player. On the back of the machine, you have the power cord, the filter cover, and this is the oxygen connector. When pressing down on this lever, that's going to help unhook the filter cover. We press down on that and this cover comes off. The filter is got a rubber seal and it seals into place. And when removing, you can only remove it from this top corner where there's a small lip or ledge. When you pull that filter off, okay, and then you just have the internals of the machine. These filters should be replaced, every 3 months, or when the machine tells you that it's time for a filter replacement. The filter can be replaced by pressing it in. Again, it's a rubber edge that seals along the edge of that lip. When replacing the filter cover, start on the bottom, latch it into place, and then press to the top and press firmly until you hear that click. Once that clicks into place, that's now been sealed and latched onto the back of the filter cover. This is the power cord. The power cord does have a small lip or ledge that locks it into place that needs to be lifted up in order to be able to remove the power cord for whatever reason. When setting up the machine for first time use, we're going to use circuit kit 900 PT 561. Again, that's 900 PT 561. That is a tubing and chamber kit. The tubing and chamber kit all come together. The chamber is an MR290, which is a self-filling Fisher and Paykel chamber. You remove the blue adapters on the top. Those are just to keep the chamber clean. On top, you have the supply tubing. This is capillary supply tubing that will eventually deliver water to the chamber. I removed that small piece of plastic. So now you have the chamber and a small spike. That spike will go into our bag in just a moment. When using the MR290 chamber and the Airvo, it will come with a small adapter that goes onto the top of the chamber. That small adapter, the two wider holes will be placed onto the top of the chamber. Press it down gently. Then sliding the MR290 has a small lip around the edge that will slide into this small groove on the front of the device. So when I press down on that front lever with the canister, it will slide onto that plate and lock into place. The two top holes need to line up with the rubber grommets that are on the Airvo, and then pressed into place until you hear the device click. When you hear that click, that means that the MR290 is locked onto the Airvo and will not easily be able to be removed or by accident. The supply tubing with the spike, that will be placed into a 900 PT 401 refillable bag. There's a rubber spot on the bottom that spike will slide into, and you press it into place. Once that spike has been pressed into place, then you're able to fill your 900 PT 401 with distilled, sterile, or boiled tap water. Okay, so distilled water or with boiled tap water. The circuit, again, this comes with the 900 PT 561 kit. The circuit has two ends. This is the patient end. This is the machine end. The machine end has a clip into place circuit, has two small wires. That's to heat the circuit. And then this is where the airflow is being delivered. Okay. On the top of that machine, we have that hole. That's where the patient airflow is going to be coming from, and two small dots that those pins are going to fit into. So I'm going to place this onto the circuit and press it into place. You heard that click, lets you know that it's been locked into place. Again, this is the patient end where the airflow is going to be coming from, and we have a couple different interfaces that can deliver this humidified gas to the patient. Those interfaces are the OPT 570. This is the direct connect interface for tracheostomy patients. This interface, the two will connect together. There are small cutouts where that will fit into the patient's circuit. And when you kind of turn it sideways, you feel it snap into place. That lets you know that it's connected. This interface will connect directly to a tracheostomy for humidified airflow delivery. The other style interface that we offer is the OPT 980. This is for connecting to a trach mask for the humidified gas delivery. The OPT 980 looks very similar to the OPT 970, only this one will connect directly to the trach mask and then connect to the circuit the same way. Then this is worn over top of the tracheostomy tube. At this point, we're going to go ahead and power on the machine. When powering on the machine may take a minute to 2 minutes to warm up. You will see a spinning light on the display screen. That spinning light that shows up on the display screen is just showing you that the machine is not quite ready yet for patient use. Once you see the green check mark, then the machine will be ready for patient use. It's essentially allowing the machine to warm up and for the circuit to warm up so it's at the desired humidity and temperature for the patient. And as you can see, there's that spinning light. Most all faults in the machine or troubleshooting in the machine is displayed on the screen. It'll show you if there's no water in the chamber. It'll show you if there needs to be some type of maintenance to the machine. If for whatever reason the flow becomes occluded or that the circuit becomes disconnected from the patient, it'll show you on the display. The machine also has an app that you can download to your phone so you can practice and play with the machine virtually before using it on a patient. So now this device has warmed up. There is a check mark on the display. Again, that check mark shows that we've reached the desired temperature and that it's safe to place on the patient. The MR290 is a refillable chamber. It self-fills, so you never overfill the amount of water being delivered to the chamber. I did fill up the 900 PT 401. I added water to that, and that water is flown into the chamber. Since I have that check mark, the circuit is slightly warm to the touch, the chamber is slightly warm to the touch. There are 3 temperature settings on the device. Those 3 temperature settings are 31 degrees centigrade, 34 degrees centigrade, and 37 degrees centigrade. 37 degrees centigrade is equivalent to 98.6 degrees and is the highest amount of humidity that can be delivered to the patient. The flows are variable. There are both pediatric settings for the flow as well as adult settings for the flow. And the amount of flow can be prescribed by the physician, and temperature is normally adjusted to patient's comfort. One of the benefits of the Airvo 2 is what's called the drying cycle. In most patient setups, they'll be set up to what's called a MyAirvo 2. The MyAirvo 2 mode, when you press and power off the machine, it'll go through a 99-minute drying cycle. The circuit will get a little bit warmer and air will continue to flow through the circuit for 99 minutes, drying it out to reduce the potential for bacterial growth. So the circuit and the machine will run, again, a 99-minute drying cycle. If for whatever reason you want to end that drying cycle early in order to place the patient potentially back on the machine, you can press and hold the power button until which time the machine powers off. Once the machine is powered off, you can then restart the machine until which time you get the check mark and place the patient onto the device. I'm going to place the machine onto the Airvo stand. There are 2 pegs on the Airvo stand. Those 2 pegs fit into 2 holes on the bottom of the machine to prevent the machine from moving around while on a bedside or while in use. So now that the device is placed onto the stand, and I'm also going to show you the way that the circuit can be placed on the patient. The circuit can be either hung from the neck and or also clipped to their clothing. So this is the lanyard. This lanyard can be hung over the patient's neck. Okay. And then this is to help take some of the weight of the interface and the circuit off from the patient. This is a small clip that can clip onto bedding or patient's clothing. Okay, so that the circuit isn't pulling on their tracheostomy or on the trach mask. You know. I'm now going to show you how to use the manual filling chamber. This chamber will come with your Airvo and has a small funnel for manually filling it. This chamber connects very similarly to the MR290. There's no adapter that needs to go onto the top of this chamber. It's built into the chamber, and this is where the rubber grommets are going to fit. There is a fill line that's the fullest that the chamber can be. That chamber has this funnel that can fit inside for when you're filling the water. So the chamber must be removed, the funnel used, and then adding water manually. That can be sterile, distilled, or boiled water. So I'm going to remove the MR290. I'm going to slide on the HC360. The HC360 will slide into place. And you hear that lock to let you know that it has locked into place. Okay, this chamber can be utilized the same as the MR290 at this point. Okay, powering the machine back on and getting the check mark once it's reached the ability to be used on the patient. A couple other small things to point out. This small clip will fit for your circuit. You can plug your circuit onto that small clip so that this isn't, the interface isn't left on the stand or left to be dirty. The surface of the machine should be wiped down every week and as needed. So wiping down the exterior of the machine should be something that's done once a week. If you're looking to find out what settings the patient is on, we mentioned earlier the play button. That play button is the bottom button along the left-hand side of the screen, and you can press the play button. That'll show you the displayed settings, meaning what the temperature is, 31, 34, 37, what the flow is, the speed at which the humidified gas is being delivered to the patient, and then also what the display setting, daytime or nighttime, is, and then the number of hours that the patient has utilized the machine and the machine's been on. Those are all things that will commonly be displayed on the front of the machine when you press the play button. Alarms that may show up on the display are either yellow alarms, in which case you'll see a small stoplight with a yellow light on it. A yellow alarm is something that is not impeding the patient's being able to have the device deliver the flow or the heat to them. In most cases, it's some type of alarm, showing that it needs to be refilled with water, or an alarm showing that the circuit may have gotten slightly disconnected, or that a maintenance procedure needs to be placed on the machine, but the maintenance procedure isn't something that's impeding the patient's delivery of the humidified gas. Let us know if you have a yellow alarm that is for maintenance, and a respiratory therapist will come to the home to perform the maintenance procedure.